What factors should be considered, or do you consider when working with a patient to choose a treatment option?
I think anemia is by far the most common presentation for patients with low risk MDS. So whenever I'm making a decision for patients with low risk MDS, I'm always thinking certain markers that can help me guide between decision making between one treatment or the other. Those markers typically are the erythropoietin levels, transfusion burden, how much transfusion requirements are there, and then based on these factors, you can often decide between erythropoietin stimulating agent and luspatercept. I think convenience is another thing, and then physician who's treating, their familiarity is an important one as well. Then cost and insurance coverage also play a huge role in the decision making. But I think there are so many treatment options. At the end of the day, my decision making is what is the most appropriate and the best care for my patient, and that's what goes up top. And then we look at the secondary factors, looking at toxicities and matching up if there's something that can be more harmful than beneficial for our patient, then obviously that goes down lower in the list. And so forth, cost and insurance also play a role there as well.
Okay. And what patients should, and what questions should patients be asking their healthcare team when they're considering the treatment options?
Yes, I think some of the things that are important to ask are, so inherently myelodysplastic syndrome increases the risk of cardiovascular disease, atherosclerotic disease, stroke, hypertension. So I think some of the side effects that you have to take into consideration are if someone has had a recent stroke, recent heart problem, then tailoring therapies based on that is an important one. And also the time spent in the hospital, because uh, being transfusion dependent takes a lot of time away from work, takes a lot of time away from their loved ones. So I think if they to balance with quality of life, it's important to choose a treatment that keeps patients out of the hospital, that keeps patient out of the infusion centers. So the treatment that would give them least transfusion dependence and most time away from the hospital, a higher hemoglobin level ideally, because that'll take away the shortness of breath, the easy fatigability, and so that they can do more and add to the quality of life. So I think factoring all these, discussing all these factors with your physician is really, really important. And I think most treatments we should give, this can vary, but roughly 8 to 12 weeks for those treatments. And if they're not working, we have many options. So discuss with your physician many times. What we see is that there's a treatment started, and then our patients stay on those treatments for months and months, if not a year or two, and they're not deriving the benefit that they should or deserve to have that transfusion independence. So they're still dependent, transfusion dependent. So ask your doctor in 3 months that is there another therapy that I would be eligible for, and that would be more fruitful for my condition.